Hello guys, welcome back to our channel Physio Vibes Anatomy. Today we'll be discussing about the elbow joint and its anatomy. Before starting the video, I have a news for you people regarding the exams. After the timetable given by Dr. MGI University, Tamil Nadu, many students were in confusion and they were requesting the university to postpone the exam to reschedule it. There was about 1000 mails sent from the student side. Finally, the reply was given by the university now. In that, they clearly mentioned the exams will be in December and January in the schedule which was given already. So I'm giving that link, the document of MGI University, the reply in the description box. You can check it. So now the exams will be definitely in December or January, so there is no more confusion. So start studying, reduce your distractions and focus on your stuffs. So guys, we are now getting into the topic elbow joint. The elbow joint is a very important joint in our day-to-day activities like combing the hair, drinking coffee or wearing the clothes, whatever. This is very important joint in all those activities, and this joint is present between our arm and forearm. Here you can see, and the bones forming the joints are the lower end of humerus. This is the humerus bone in the arm, and the radius and ulnar bones of the forearm. So in this video we'll be discussing about the type of this joint, the articular surfaces and the ligaments around the joint, and the movements and clinical relevance of it. So let's get started. So the type of the elbow joint will be the synovial joint with hinge variety. Synovial joint is a freely movable joint with hinge variety, that is movements can occur only in one axis. So then the articular surfaces, there will be upper articular surface and the lower articular surface. So here you can see, in the upper articular surface you will be having two parts of articulation. This one is the capitulum. This round ball-like structure is the capitulum of the humerus, and this part is the trochlea. These two parts forms the upper articular surface, and then the lower articular surfaces will be the head of the radius, the concave head. You can see the concave head of the radius with the capitulum, and the trochlear notch. This is the trochlear notch of ulna, will be articulating with the trochlea of the humerus. So these are the upper articular surface and lower articular surface. And one more thing, above to the capitulum and trochlea there will be two fossas, the concave spaces, and this is the radial fossa. This will be the coronoid fossa. In extreme flexion, in full flexion, the head of the radius fits into the radial fossa, and the coronoid process of ulna, which will be here, it fits into the coronoid fossa of the humerus. So the upper and lower articular surfaces together forms two articulation, which is the humero-radial articulation. The capitulum articulates with the head of the radius. This is known as the humero-radial articulation. And the second one is humero-ulnar articulation, which is the trochlea with the ulnar bone. So two articulations are in the elbow joint, humero-radial and humero-ulnar. So guys, now you can see in the picture, I think my laptop is visible to you. So you can see the upper articular surface of the elbow joint. Here the lower end of humerus, the capitulum and the trochlea, and above that radial fossa and the coronoid fossa. And here you can see, this is the posterior side of the lower end of humerus. The oligrenal fossa will be there. The oligrenal process of ulna will fit into it in the extreme extension, but this is not the articulating surface. And now you can see this is how the inferior view of the articular surface. You can see the capitulum with which the radius gets articulated, and the trochlear notch of ulna will get articulated. And now in this picture you can clearly see this is the elbow joint. The articulation, humero-radial joint and humero-ulnar joint together forms the elbow joint. Then now we'll see the important topic in the joint, that is the ligaments of the joint. There are only 3 ligaments in the elbow joint, and it is very easy. I hope I'll make it simple for you to understand. The first one is the capsule. We know the joint capsule will be there like in hip joint and shoulder joint. So the capsule will be covering the joint entirely, like superiorly it is attached above the fossas. Above the capitulum and trochlea, above the fossas, it will be attached. So from here it will be coming like this. And inferiorly it is attached to the margins of radial head and the margins of trochlear notch of ulna. So it will be covering the joint like this. Posteriorly also the capsule will be covering above the olecranon fossa and the inferior of the radius and ulna bones. Then the second one, the radial collateral ligament. In the name itself you can understand the radial collateral ligament. So it will be attaching to the radius bones. So it will be coming from the lateral epicondyle. This is the lateral epicondyle of humerus and this is the medial epicondyle of humerus, we know. So this ligament comes from the lateral epicondyle and attaches the radius bone. And the third one is the ulnar collateral ligament, which will be coming from the medial epicondyle of humerus and attaching the ulnar bone. So this is how it will be. This ligament comes from the lateral epicondyle and attaches the radius bone. And the third one is the ulnar collateral ligament, which will be coming from the medial epicondyle of humerus and attaching the ulnar bone. So this is how it will be. So here you can clearly see the capsule, the articular capsule. This is how it covers. Above the coronoid and radial fossa it is attaching in the humerus, and below it will be attaching to the head of radius and the trochlear notch of ulna. And then the lateral collateral ligament, which will be coming here as I showed you in the diagram. Lateral collateral ligament from the lateral epicondyle to the head, and medial collateral ligament coming from the medial epicondyle to the ulnar bone. And both these radial and ulnar collateral ligaments are the triangular shaped ligament. So the radial collateral will be in the lateral side and ulnar collateral is a triangular ligament, and it will be having 3 bands, anterior and posterior bands. This is how it will be. Anterior and posterior bands, they are connected by an transverse or oblique band fibers. So the triangular ulnar collateral ligament and the radial collateral ligament will be, this is the lateral epicondyle, this is the head of humerus, so it will be like this. So this ligament is also triangular in shape. So here you can see the ulnar collateral ligament, the anterior and posterior bands, and with the transverse band or oblique band. And the next one is the radial collateral ligament. Here you can see from the lateral epicondyle, and this ligament joins with the annular ligament, which is a ligament covering the head of the radius.